good afternoon, everyone. This is Norman Morris, CEO of Louisiana Realtors. And on behalf of Cindy Dyer, our 2024 Louisiana Realtor President, our Executive Committee and Board of Directors, we want to welcome you to a session which is going to give you a tremendous amount of information on the new healthcare benefit that Louisiana Realtors was able to form a partnership with the Amalgamated Local 426 and CapCare to provide this benefit to our members statewide in Louisiana on a major medical health plan. Hopefully today you'll gain some great knowledge on the plan itself, all of the ins and outs of how to navigate the plan and what to do. Louisiana Realtors in the last week has sent out an initial email to all members concerning the plan, how to access the web portal, and look at the plans and make decisions as you move forward. We're also going to tape this session today and place that up on the CapCare and plan on Louisiana Realtors website as well for future reference, or to send to those that weren't able to make the webinar today. So without further ado, if you'll put some questions in the chat along the way, Danielle will monitor those as we go through this, and we will try to get answers for you either during the session today or follow back up with you after. We're truly excited to be able to offer this member benefit with our relationship with CapCare and the Local 426. At this time, I'd like to introduce Bridget Gillis and Margaret Collignon. Bridget is with the Concord Management Resources Group, and Margaret is with the PL Group, and they're the ones that work together at with CapCare and the local to provide this healthcare benefit to all Louisiana Realtor members. So I'll turn it over to them to walk you through a PowerPoint and make you more aware of this great benefit Louisiana Realtors is providing to its members.
Thank you. Did a great introduction. Great information so far. Wanted to thank everybody for taking the time this afternoon. My name is Bridget Gillis. As Norm mentioned, I work for Concord Management. Our team handles all of the education awareness, onboarding, proposal generation, concierge, billing that you may have prior to becoming a member of the program or even after. So we're really the liaison, the first point of contact, should you have any questions about the program. So to give you a little bit of background, as Norm mentioned, members of the Louisiana Realtors now have access to this healthcare member benefit program. It does utilize a national PPO network, which is available in all 50 states plus DC and Puerto Rico. So the union, sponsoring union, actually contracts with the various networks, and the network that they utilize or have a contract with is the National Blue Cross Blue Shield PPO network. So it's the blue card, meaning that you can see providers in any of the 50 states plus DC and Puerto Rico. Doesn't matter where you are, where you reside, you have access to a pretty robust network. Being a member of Louisiana Realtors, you have the opportunity to join in this member benefit program by becoming an associate member of our local union, Local 426. That in turn gives you access to not just healthcare related benefits, but your medical RX, life, accident, and various educational type programs or other programs. So we'll go into a little bit more detail about the union aspect of it, and certainly answer any questions that you might have along the way. This is an exclusive member benefit program available to members of affiliated associations. So as Norm mentioned, Louisiana Realtors is one of the newest affiliated associations. We have, with Margaret, have brought on probably 7 or 8 other state realty associations, and then CapCare, as well as a couple other business partners. We have probably 20 other associations across the country that offer this program to their members. This is not a program that's available through a health insurance broker. It's not available commercially or on the federal marketplace. So your brokers, if you work with any currently, would not have access to this, or quite honestly know all that much information about it. That is what our team is here to help facilitate, to help you make the best decision for you and your family. Compared to the small group commercial market, individual market, or the marketplace. So as we mentioned, it is a member benefit program. It's offered through a sponsoring union called Amalgamated Local 298, Local 22. They are a union out of New York. They have been around for over 50 years. They're actually a toy and novelty union. And the way that we've been able to make this work is CapCare, who's a program manager, partnered with New York Practice Management, and they formed their own local union called Amalgamated Local 426. That is actually the union that if you choose to enroll in the program, you become an associate member of Local 426. The nice thing about that is, even though it is a union, as an associate member, you do not have any collective bargaining or voting rights. It really is a vehicle that allows you to access these member benefits. So it is something that unions have done for the last 20, 30 years for apprentices, by being able to offer apprentices all of the benefits without being a full-time union member. So it is a way to offer a program without having some of the either negativity towards what a union, some folks represent a union to be, or even worrying that you will be asked to picket or be asked to vote in any way. That just does not happen as an associate membership. The sponsoring union is a Taft-Hartley self-insured health and welfare fund. They currently have over 7,000 of their own participants, and then with our membership, we have an additional 2,000. Again, as a self-insured program, they take all the risk on behalf of all of our enrolled members. They collect all the monthly premiums or contributions, they pay the claims, and then they procure all of the different stop loss coverages and what have you. So even though it is a self-insured program, you get rates that are at a four-tier level. You're not paying per se for your own claims. The higher union is doing that. This would look and feel like a fully insured commercial product. We call it a fully funded program. So as I mentioned, 298, they contract with their own vendors, including the network, which I mentioned is Blue Cross Blue Shield National PPO. Anthem does the back office claims processing. You actually have access to an Anthem portal to look up providers and view some claim information. They contract with their pharmacy vendors and third-party administrators. So again, when the claims come into the system, Anthem will process them up against their PPO contracted rates, and then the union pays them with the monies that they receive as far as premiums. They provide Local 426 members with rates and plan options each year. So there are 4-tier rate structures: employee, employee plus child, employee, spouse, and family. So you are able to cover your dependents under the program. The rates are not based on age, gender, medical underwriting, or pre-existing conditions. The rates are the rates, the plans are the plans, regardless of where you reside or what age or health factors you may have. Benefit program rates are based on the total plan participants, meaning it's not just our Cap Care membership of 2,000, it's also based on the 7,000 union sponsor participants as well. So the value of leveraging a large group program benefits everybody. Being that it's self-insured, that also benefits folks because there are no shareholders, there are no profit centers, right? Insurance companies tend to be profit centers. The union collects the amount of contributions or premiums that it needs to pay claims, to pay admin fees, to pay the vendors, and then the rest is left in surplus. Or if they need an increase, they will go out to the membership via a rate increase the following year. Just to kind of touch on some of the high level items, again, National PPO Network. It's not something that you pay additional for. Unions tend to be very rich in plan designs. The network coverage is in all 50 states. It's fully funded, meaning that based on your benefit, if you've met your deductible and coinsurance, it's first dollar coverage. We say coverage cannot be denied, meaning that as long as you are a member in good standing with the Louisiana Realtors and you are actively at work, you are eligible for the program. We cannot deny coverage. As I mentioned, the rates are similar to a large group rate. So this would be no different than if you were becoming a employee enrolled member of like a Walmart or a Home Depot. This is a large employer, so you're able to get the value of not just your population or your census. It is a comprehensive program, not short-term medical plan with limited duration of benefits. So it doesn't have limits on out of network as far as you can only get so much as far as a dollar threshold. This really is based on your benefits. It has unlimited out of pocket. You do enjoy 100% of the plan benefits upon issue. So again, we have 9 plan designs. So depending on the plan that you choose, you would be in benefits based on meeting deductibles and coinsurance. We do have an online technology platform for ease of enrollment. We'll go into a little bit more how that works. And then, as I mentioned, our team is a concierge team. Everything from assisting you with answering benefit questions to helping you enroll, to helping you if you have any claims or ID card or whatever issues you might have after becoming a member. These programs are ACA compliant. They do include 10 essential benefits per ACA guidelines. The plans have individual deductibles ranging from $0 to $4,000. The individual maximum out of pocket ranges from $5,350 to $9,100 per individual. Those tend to be very low in comparison to the market. We also have coinsurance options in network from 0 to 50%. We have copay only plan options that have no deductible, no coinsurance. Those are plans that you really can't find anymore, even on the exchange. And if you do, they're pretty significant in cost. And then the plans do have 100% preventative care benefits as required by ACA as well. We have 9 plan options. And again, I'm not going to go into a lot of depth on these because this information is included in the proposals that you can either generate for yourself or that you can request from our team. But basically, our lowest plan option starts with a $3,000 deductible, 50-50 coinsurance, meaning once you meet your deductible, you pay 50%. And your maximum out of pocket, including deductible and coinsurance, is $5,350. So for somebody that doesn't have a lot of medical needs, doesn't have issues. This is a great plan to cover you for anything catastrophic. Again, your maximum liability for an individual is $5,350. The other nice thing about this is the prescription benefits do not apply to the deductible. So if you do have some medications that you take, it would be at a copay level. This is a program that does not cover specialty medications. They do have a vendor that assists. It's an assistance program that works with members for manufacturer rebates, cost savings, coupons. We talk about specialty meds. We have formularies that we can provide that will show you what medications fall under that. But these are really your high level tier 4 medications that, again, doing your due diligence and depending on what circumstances, this may or may not be the best option. But again, the vendor payer matrix does work with the members. They have about a 93% success rate in being able to assist with manufacturer rebates or cost savings. The rate for this program is $660 a single, $1,624 a family. Then we go, and I don't know why I lost some of the other plans. Then we go to our highest plan option, just to give you a scope of what's in between. This is a no deductible, 100% co-insurance, meaning you don't pay anything other than co-pays for physician visits, co-pays for preventative, $250 copay for a hospital stay. It's pretty much copay only plan. You have out-of-network benefits. You have low copays on your prescription. And this program is a little over $1,100 for an individual. Very affordable, $2,600 for a family. A program like this on the exchange or in the commercial market would range anywhere from $4,000 to $6,000 in the market, depending on what carrier and if you can get a national network. Okay. So the benefit designs, they are static. They can't be changed or revised. If there are any plan changes that are as a result of the union making a plan change, we'll communicate that out to the members. If we do add additional programs or remove programs, we'll also communicate that out to the members. These changes wouldn't take effect until January 1st of every year, being that we have a rate period through December 31st, 2024. So if you do enroll on the 1st of the month, so example, if you enroll June 1st, you would renew January 1st of the following year. If you enroll December 1st, you would renew January 1st. We would know where the rates increase would be, so you would not be going in blindly. If you decide that you want to enroll December 1st, we would know what the rates would be coming 1/1. As I mentioned, the specialty drug coverage, there is a pre-authorization. It then goes to the payer matrix program. So again, these are some of the questions, or if you have concerns offline, you can either email our team or call our team, and we can help you answer any of those questions or find out how something will be handled. This is also an important point. Automobile accidents, medical services related to automobile accidents are not covered under the plan. One reason being most folks have auto insurance, they have workers' comp, depending on if you're driving during work. There's really only, and it's a statistic, 0.8% of all medical claims are related to auto accidents. With this, we will be adding a auto accident medical reimbursement program and an AD&D program. It will be embedded into the offering. So it will be, right now, we are looking at an unlimited medical reimbursement, and I believe $100,000 AD&D. That's accident and disability. So more to come on that, but again, that will help offset any medical expenses related to an auto accident. I've been enrolled in this program for the last 3 years. I have added an additional coverage to my auto policy. I believe I added about $200,000, and I pay about $24 a month extra for that. So once this program comes about, I'll be able to drop that additional coverage, especially knowing that this will be an unlimited medical reimbursement program. In addition to the medical programs, we also have a 24/7 accident that is separate from the AD&D that will be offered. This is like an AFLAC. We have a specified disease, hospital indemnity, as well as life insurance. Specified disease and life insurance is age-based, but again, the rates are based on the larger population. So the rates tend to be very favorable. The auto or the accident 24/7 for an individual, it's about $4 a month. For a family, I think it's about $10, $10 or $12 a month. So it pays in a lump sum benefit. It can pay for any out-of-pocket medical expenses. So if you do have a high deductible, you can help offset some of those expenses. Even if you leave the program, you can continue to pay the premiums and take that program with you. Okay, so key dates and information. Anyone can enroll on the 1st of the month. As I mentioned, the rates are good through 12/31/2024. Open enrollment closes 30 days prior to the effective date. So currently we're enrolling for 7/1 effective date. That open enrollment will close in a couple days at the end of May. If you do enroll dependents, we will need marriage certificates and birth certificates. And invoices are generated a month in advance on the 2nd and processed on the 4th prior to the effective date. Reason being, the union requires that they have the funds so they can start paying claims. Payments are auto debited and members have the ability to pay by ACH or credit card. As I mentioned, we have made it pretty easy to enroll in the program. First, you'd receive a proposal so you can review the plans and the rates. There's no obligation to receiving a proposal. No one is going to harass you. We are not selling this program. We're not being paid commissions for this program. We are looking to educate the members so they can make the best choice for yourself and or your family. Then after receiving a proposal, you can set up your own account on the online system and you can process your application online and e-sign. Or if you don't want to go the technology route, you can also request paper forms from our team and we can complete the application for you. So in order to get a proposal, there are a couple ways to get it. We have provided the team, the Louisiana team, and I believe you have it on your site, instructions on how to generate a proposal and create an account. So you would go to the landing page. By generating proposal, you would select if you're an independent contractor, if you're an employer. You'd start typing in your association name. You type in your company name. If you're an independent contractor, you would type in the name of either your LLC that you have on your own or the entity, the broker agent where you hang your license. We just need that for identification purposes. Reason being, we will bump that up against either your 1099 document that gets uploaded at time of enrollment or an independent contractor agreement to ensure that it's one of our checkpoints to ensure you're actively at work. You would then put in first name, last name, email, zip code, coverage start date. You get three months view. So right now we would have 718191, and then you'd click view plans and proposals. So just quickly, these are the instructions on getting through generating your own proposal. If you click generate a proposal, this is the screen you'd come to. And then here's the instructions. As I mentioned, you would type in or click on independent contractor, start typing in Louisiana, enter your information, select the effective date, view plans and proposals. And we have it stepped out here, hopefully to make it easy for you to navigate. You can download the proposal, email the proposal, look at plan details, compare plans. And if you click proceed to enrollment, that is what activates your account. And then once you activate your account, you'll have the ability to set up username and password. This is a copy of what the proposal would look like. So it has member benefit proposal for Louisiana. It has plan designs, rates, important information, summary of program, key entities and roles. Here's the email that you would get if you emailed the application. We give you the email address that it comes from, so you can add that to your safe list so it doesn't go into junk or spam. And then we've also shown what happens if you compare plans, if you want to do a little bit deeper dive while you're in the system. The SBCs, this is if you click on plan detail, you can download all of this summary of benefits coverage. And then once you proceed to enrollment, you can set up your own account. So you actually can put in your own username, password, set up your security questions and click activate. And once you're activated, you now will be able to log in and start your application process. So again, I believe Danielle has supplied this on the member site. And if you do get stuck for any reason, our team is more than happy to assist you at any time, answer questions. If you hit a snag with the enrollment, we certainly can assist you with that as well. So, and I believe Danielle has on all of the materials the email address, capcareenrollment@concordmgt.com, that goes to our concierge team, as well as our toll-free number, 833-287-4765. We do have different prompts. So if once you're enrolled, you have a billing question, you can go right to that team. If you have a claims or concierge question after enrollment, you can click that prompt as well. So I know that was pretty quick. Does anyone have any questions about the program?
Maybe touch on if they want to do a consultation, once they get into the system and so forth, all they need to do is either email or call that number, and y'all will come on and set up a time where they can go through a consultation through the concierge service.
Yes. Yep. Anytime.
Okay.
All right. Yep. So that 833 number will go to any one of our team members. We can answer questions if you need additional information, clarifications. That's what we're here to do, to assist, to help you make your best decision.
You want to drop any questions in the Q&A section? We can answer those publicly.
Okay, so I do see Wanda. So yes, the 660 currently is the lowest cost plan available. We do have information to the union, asking them to look at offering a few other programs.
Danielle, will you also put up info at larealtors.org in case we get off the session here today and someone has a question? We can get that question and forward it to Margaret or Bridget, and hopefully we can send that back to them as well, because we'll have the email address of the member. Because I know some people may get off today and have some further questions, but certainly we encourage you to use that email address that Bridget has up on her screen now as a first choice. I see a question that says, what is a W number? They saw it on the page when they tried to log in prior to the call.
A W number.
Would that be the NERDS number?
Yeah, it could be your realtor membership number is what I'm thinking. Your M1 or formerly known as your NERDS number, but it's your M1 number.
Yeah, depending on the W number, depending on where they were in the site, we don't, we don't validate that NERDS number. We don't ask for that, right? Because you validate the membership when we send you the reporting. But Monica, if you had any questions, so typically a W number might be a member number. It might be the coding that is the plan, a WGS number that might be a group number that's related to the plan. So unless that was on the Zoom invite that was requesting a number, we can take that offline, Monica, if you want to. We can walk through and answer that question more specifically.
Or
All right.
Monica, once you hit get proposal on that website on our page, it brings you to the LR member portal, and that has a login because the link for the proposal is a members only kind of login. So if you're having trouble with logging into our member portal, it is your NERDS ID, your M1 number as your username or password. If you're having trouble with that, you can just shoot us an email and I can reset it for you if that's the case. That might be what you're referring to. I'm not quite sure. So, but just let us know, Monica. Thank you.
The next one is, what if you have a pre-existing condition? Does this affect enrollment?
No, it does not. As long as you are actively at work and a member in good standing, you qualify for the program.
All right, the next question is the cheapest family plan $1,600?
Yes, the base plan currently is $1,624 for a family.
Okay. One of the questions was they're assuming the program does not include eye or dental care. Is that correct?
That is correct. I believe some of the plans cover vision exam, but it doesn't cover lenses and contacts. We are working with a couple vendors to provide an ancillary option as well for dental and vision. And we will send that out for the association to review once we have that. And just as one of the other things, so knowing that everybody renews January 1st, if you do come into the plan mid-year, the union will provide a deductible credit, meaning if you are currently on a program that has a deductible and you or your family members have met certain level of deductibles, they will apply that. So if you have an explanation of benefits, your last one from your previous carrier, you would submit that and we can get the deductible applied.
Okay. All right, two more questions that we just got. What if you needed eye surgery for some reason? Is that covered under the medical portion?
without knowing specifically, I mean, if you need outpatient services, a lot of those would more than likely be covered, right? If there are exclusions, like with any plan, so I don't know if like a LASIX would be covered or something else like that. But again, each program, the summary plan documents have more of the detail of what they do and don't cover. I would assume that most of anything surgical, outpatient, inpatient would require what's called a pre-authorization. So, again, if the eye surgery was cosmetic, then no. But, I think the vision benefit that's excluded or not offered is more so of your lenses and your contacts.
And y'all can help answer that question specifically individual to individual on the nature of what the surgery would entail, I'm assuming.
Yep. So the insulin, they do cover insulin. And I believe it does fall under the, you would need medical necessity pre-auth, but it falls under the prescription program.
All right. Any further questions? And certainly the email that was up on the screen, as I mentioned earlier, please, if you have some questions and, as you start to look at the plan, think about it, email those to on this side here, or use the telephone number. Certainly as a fallback, if you can't, you can send it to info@larealtors.org, and we will certainly get that question up to them to answer. But I think the quickest way to get your questions answered would be through the site now up on the screen. Let me pull it up here at the CapCare enrollment at concordmanagement.com or the 833-287-4765 number. Are there any last minute questions that we can try to answer before we conclude our session today? Okay, remember, we got one more, I think, that came in. Jeff, I think you saw the plans 1 and 3 and 7 and 9. I think she did just, I think they just scrolled past 4 and 5. I think there's 9 options. Is that correct?
Yep, I have 4 and 5 up now, 4, 5, 6. There are 9 plan options. And again, those will be in the proposals. A lot of the information in this presentation is in the proposal, including these plan designs and rates.
And we sure hope that not only this session has helped you somewhat, but certainly with the feedback, and let us know as you go through this process. Obviously, this is going to be a direct decision. What makes sense for you and your family, based on this plan or other plans, and certainly we'll facilitate information with CapCare and the team. But certainly we're not going to be involved directly or can answer any questions specifically about the plans or things like that. And that's why we wanted you to go directly where it would be easier for you to deal directly with the plan or plans that are offered through our relationship with the local CapCare and PLC, that we can make sure you get what you need to make an informed decision. And hopefully this can benefit some out there that can get equal or better coverage with maybe some savings on the cost at the end of the day as well. All right, Bridget, any other items that y'all wanted to cover before we concluded our session today?
No, just to thank everybody for joining the webinar. As I mentioned, our team is here to answer any questions, to help you navigate and make the best decision for you. So even if it means you want to just fill out paper and enroll that way. So whatever our team can do to help, we're certainly here to help bring hopefully a better alternative to your membership.